What I would like to talk about today is the survey that we as a scientific panel of the European Academy of Neurology on palliative care performed at the beginning of this year. So a little bit about the background. The neurological conditions, or the conditions affecting the nervous system, are increasing in their prevalence and are actually emerging as a leading cause of disability worldwide. Here in Europe, because our population is rapidly aging and the mean age in Europe is higher than the mean age globally, we are particularly vulnerable for those conditions, which are very often age-related. And that's why really we urgently need prevention, treatment and management strategies. So people living with long-term neurological conditions, and these are the conditions that arise from disease, damage or injury of the central nervous system and are afterwards affecting individuals and their family for the rest of their lives. So these people experience complex and often refractory symptoms, which often lead to hospital admissions and are very complex to treat. So the treatment of such conditions is really challenging. The accessibility and availability and also the expertise that is available is insufficient. So in this survey, we have asked European neurologists what are the biggest challenges they are facing while they are providing care for their patients with long-term neurological conditions. So over 150 neurologists working in Europe participated in our survey, and what I think were the most important findings was that the majority of participants, that the majority of European neurologists expressed their unsatisfaction with the psychosocial and spiritual support that is offered to patients with long-term neurological conditions and their families in the situations when they experience acute worsening of their condition. The European neurologists also stated that the availability of long-term health care that those people require is not optimal. Another important finding of the survey are the healthcare disparities that were reported between the Northwest and Southeast European region, while the neurologists practicing in South and East Europe expressed concerns much more frequently with regards to those aspects than those practicing in Northwest Europe. So the first step is to publish those findings. We are disseminating it. We are disseminating those findings in different symposia, lectures, presentations, and I also think it would be really important to collaborate directly with patient associations to bring it directly.